Thank you, Mr. Chairman, and Commissioner, thanks for being here. Appreciate your service. The House Appropriations Committee has expressed concerns that the SSA's antiquated IT service management system is adversely impacting agency employees' ability to deliver the service and efficiency that Americans, including many of my constituents in Michigan, expects and deserves. And it's been 4 years since the SSA began modernizing its IT service management tools in fiscal year 2021 to improve customer service, optimize operational efficiency, and maximize organizational productivity. Despite this effort, I continue to hear complaints from my constituents that their experience with SSA doesn't meet what they would expect from a 21st century economy.
That's true.
Can you explain why it's taking SSA several years to modernize its IT systems when other organizations, both private and public, seem to do it sooner?
Yes, sir. It comes down to a lack of money. In other words, well, I was one of my many conversations with Chairman Ferguson. He said, well, why can't you make up that yawning gap in the reduction of staff with better IT? And I said, because you haven't increased our IT funding either. And when you level fund the agency's IT budget, what the result of that is that, you know, where, say, 15 years ago, Congressman, you know, you might have had this much that went to keeping the systems, the legacy systems tied together, and then you'd have this much more for modernization. But with 10 years of level funding, more and more is taken up with keeping green screens and COBOL taped together rather than doing the modernization. But we have had one big success is the online, which the White House OMB rated as one of the best website in the federal government. We don't have enough lines of service on there. We would like to put more on there. There's about 8 things that you can do online, and we would like to add more to it. We also recently, on August 22nd, we cut over to a whole new 800 number system with AWS Connect. And that will give us a sort of customer relations management that people are accustomed to receiving from their bank. There's other things we'd like to do on notifying people through text. It's really a lack of investment. And I'm glad you asked that question, because one of my deep concerns about this agency when I depart next Friday is a looming problem on the horizon of antiquated IT systems totally breaking down or being shut down by bad actors.
So if I could just summarize, so what you're saying is the amount that's been spent modernizing really has even struggled to maintain.
Yes, sir. We like to call it modernize. We like to whistle past the lack of funding by giving our people some hope that it's going to be modernized. I mean, we've done a lot of things. I mean, we created there was a tool we created called AMP to automate Medicare-only claims, and that worked really great. We've been able to do some other things like that, cut over to AWS, which also saves us money, by the way, and is going to give us greater capacity. But at the end of the day, this agency hasn't received a modernization fund, I mean, a real investment since Walter Cronkite reported on it in the 1960s. And we used to be a leader in the world.
So, I mean, my constituents would think $1.5 billion is quite an investment.
I know, the numbers are big.
What would be the right number?
The answer to that is a twofold. You know, these CRs hurt us in a lot of ways, including this. I mean, when we have to, you know, put the brakes on and go hiring freeze, that's one hurt. The IT funding really needs to be approximately a $5 billion shot, one time, but without any threat that it will be taken back. With $5 billion in IT modernization, I have no doubt this agency could move to the forefront again in customer service.
And then what would the annual requirement be after that?
Well, right now the level it's at is kind of what they call in the agency lights on. And even with lights on, we had 2 incidences where the lights went totally off this year. So the ongoing funding would be about what you see right now. That's kind of the lights on maintenance funding. But a one-term shot, Congressman, that we would be able to plan and execute and know that we could get done, because a lot of these modernization, the little ones around the edges, the history over the last 10 years of reductions is that they start them and then they have to stop mid-year because they don't have the funding to complete them. And then a new budget's passed, they start again, and they have to, that's the worst way to do it.
Okay. Thank you.
Thank
Mr.
you.
Chairman, I yield back.